Okay, so we have one of our nice patients here who's paid me all this money, and he's kind of a little bit grumpy. He says, okay, when do I stop the Gatorade? And what can you eat? And the answer to that is involved a couple of things. First of all, we want to remind you, of course, we cut through the stomach and stitched it and sewed it, and so it has to heal. And just as we kind of look at the skin on your abdomen, that's healing like the inside of you. So when you look down and we take the staples out today, that's kind of a reminder of what's happening inside. So today, tomorrow, the next day, you're almost completely healed and the staples don't make much difference. We wouldn't want you to try to, for example, swallow a whole watermelon, because that might tear the insides. But short of that, almost anything's okay. Now, as you know, our general advice for the next several days and the next several weeks is to stay with kind of a very unusual, almost liquid diet. And so that's the Gatorade, the yogurt, juices, tomato juice, V8, orange juice, grapefruit juice, things like that, and then all kinds of soups. Chicken noodle soup, vegetable soup, things like that. And notice I did not say broths. Some people get all focused and say, I just can have broth. And if you want to do that, you may, but we don't think you have to do that. Now, beyond that, people start saying, well, I'm really tired of that diet. Even though it's been only a week, I'm tired of that. So can I go beyond that? And the answer is yes. You can actually eat anything. But you can't eat very much, and you can't eat very fast, and you need to chew it well. So there are three things that we want to give you as a guideline. If you decide that you're stuck and you say, I can't live another moment on soup and Gatorade, I'm going to go crazy. In America, if you're a postal worker, you get a gun and you shoot everybody. And so rather than doing that, if you're at your wit's end and you must have something else, almost anything else is okay if you remember three guidelines. Very, very small amounts. Think of a baby spoon. Very, very slowly. And very well chewed. So if you were to follow those guidelines, almost anything's okay. Now, we have had people listen to that partway, go out and try and eat a whole hamburger. And that's not what I'm saying. But we have had a contractor who had surgery with me come back a week after surgery, and he said the day after surgery he left the hospital, felt great, actually did some work and estimated a contractor job, and had a hamburger the day after surgery. Now, then he said, well, I peeled off the bread, I took one little tiny bit of the hamburger, I chewed it for a long time and swallowed it. That actually is okay. Now, we don't tell our patients that they can have a hamburger because they may be thinking of the way you ate a hamburger before surgery. But back to your question, what can you have? You can have almost anything, very small amounts, very slowly, and very well chewed. So if you get a taste for anything at all, it's okay. But anything at all is going to be bad if you take too much, too fast, and poorly chewed. So even Gatorade or soup or crackers will hurt you if you take a whole bunch very fast. Does that sound okay?
Yeah.
Good. And I saw a hand up there.
Do you kind of recommend like